Is there public comment?
Yes.
Okay.
So my name is Regina Downer. Should I say right here?
You can come up front. We won't bite. Bruce might, but we won't.
Yeah. Bruce,
I know
take it
that.
easy, big.
We'll bring a chair up so you can
Thank
get
you.
a good view.
I just want
No, that's okay, just look in the big screen.
to, so I am the community nurse advocate and proud of it, and carry an active caseload of more than 30 clients who I visit in the 6 mountain towns. I'm here tonight to just give you a little bit of an update on what's going on with COVID and specifically Delta. I started thinking about this in last summer, right at this time, and I know it because we were getting ready to leave for vacation. COVID was ramping up, and people were wearing masks or not wearing masks. There were no vaccinations available, and we were nervous. People were coming from all over, and everybody was nervous. Now we're sort of at that same point. Delta has changed things, and I just want to give you a little idea of how Delta came about. And here's an example. When you take an antibiotic for, say, strep throat, you take 10 days of it, but if you short circuit it and you only take 5 days of it, then that bacteria gets stronger and you get sicker at the end of that week. And similarly with COVID Delta, that virus has morphed and changed in people who are giving it a host place, an unvaccinated person who then gets the virus, and then it changes and it gets a little stronger and it goes on to the next person, and that's sort of how it spreads. And so the goal is to sort of cut down on the reservoir of where those viruses can morph, because now there's an E variant on the horizon, which is the one after D. And we don't really know how this is going to go. So last winter, I visited all of my people wearing this and gloves. We delivered meals, and we tried very hard to get people to be able to hear us. My volunteers also did this. I don't want to go back to this, and our people don't want us to go back to this, because no one really likes to see you looking like that. It's pretty scary. So we have a reservoir of kids who are unvaccinated and can't be vaccinated, and I understand that. And I, as a parent, would be nervous about vaccinating a child under the age of 12, but they're working on it. So with that kind of a reservoir, it's only going to happen, especially when they all go back to school, that, we're going to have more Delta floating around the community. Right now, we have Springfield Medical requiring masks, and SASH, which is the Safe and Supportive Housing at Home organization that I told you about, making all of their employees mask, and Dartmouth is mandating that all of their employees be vaccinated. So what I think we should all consider is that there's never going to be an absolute answer to this, and we're doing the best we can to make decisions that are safe. And I know I'm not in a decision-making position, but I am wearing masks when I am in indoor situations. When I spoke to Don Collish, who's our colleague at Dartmouth and at the VA, he's a physician who works with Upper Valley community nurses, and he basically said tonight that indoor activities of greater than 15 people, you're going to want to wear a mask. There's pretty much a chance that at least one of those people is not vaccinated. Spreading the Delta virus to a person who is vaccinated, okay, which can happen, breakthrough cases. We used to say that those people who originally got COVID that way could not really transmit it, but because Delta is so powerful, it does transmit from people who have been vaccinated who get the disease. It is, if some of you remember measles and chickenpox, you could be in the room with one person who has chickenpox and everybody gets chickenpox. It's equally as spreadable as measles and chickenpox. And I think if you think back on times when there was a push to get polio vaccine, and even I never saw smallpox, but I remember the smallpox vaccination. Those are diseases that are very visible. And when somebody got smallpox, you had this big sort of oozing thing on your arm when you got vaccinated, and people got sores like that on their bodies and died. This disease is not that visible, okay? If somebody gets sick, they're inside, they're isolated, they're in a hospital, they're in an ICU. We don't see it. And I think when you see somebody who has had polio, it's very visible. Nobody wants their child to have that, and nobody wants their child to have smallpox. We wiped out smallpox pandemically because of vaccines. And we considerably lowered the incidence of polio because of the vaccines. So there's definitely efficacy in vaccines. And the hope is that you will hang out with vaccinated people, that you will maintain a 6-foot distance. And if you must be in a 6-foot distance, you should stay less than 10 minutes in an indoor situation without social distancing. That outdoor events are much better than indoor events, and so I would stay away from indoor events completely. And that masks are definitely where we're going. I don't know how many places will be mandating them, even for vaccinated people, but I doubt very much moving forward that you're going to be able to meet in a room like this without masks. So all of our people in my community nurse project, all of the patients have been vaccinated. All of the volunteers have been vaccinated. All the providers have been vaccinated. I don't go into a home of an unvaccinated person. So I know all of my people. I think that there are safety issues on both sides, but I think that the push is to go for the greater good and get as many people vaccinated as possible. So with that being said, I hope that everyone realizes that this is pretty serious and we're going into an unknown waters. Talk to me next week, it might be different. But for now, this is what I know, that vaccination is the way to go. So, do you have questions? I'd be happy to answer them.
A comment that I was heard the other day, and with both of my kids, with my daughter being in New York and in critical care all year, and her husband there as well. But this was not exactly related, but they sort of shared that originally, we didn't have any tools. But one of the hardest things right now for care providers, especially in areas where there's very little vaccination, in Arkansas, and it's just on such a rise, is the challenge and the frustration of the healthcare providers that are devoting their lives and stressed out and their time and energy. But you could have prevented this. I'm risking my life, my time, taking care of you because it's what I do, and you're not meeting me. You could have prevented that. And it brought tears to my eyes to think of these nurses and doctors that are in this environment, taking care of people that have not done any, they're putting them at risk. And it's the global picture of what's going on. And
I would throw out to you, and I meant to cover this tonight, is that in a group of 200 people, there's going to be 1 to 2% that are positive that you're not going to know, and you're not going to know who's vaccinated, not vaccinated. So I wanted to say, Mountain Valley Clinic here in Londonderry started every Friday offering the vaccine. It's the Moderna vaccine, and you can call and make an appointment for that if you are a patient, and you can maybe negotiate with them. There is the Walmart in Rutland is offering the vaccine, and that telephone number is 773-1600. You can also get the vaccine. It's Moderna at Springfield Hospital, Tuesdays and Wednesdays from 8 to 11. We have 5 new cases in the county of Windsor, and we have 5 new cases in I I think we're at 89. So I don't want to say that we're on the cusp of something that's greater. I don't want it to go in the way it did last year, but I really don't know. And you can talk to me in 2 weeks and it could be different. But for now, this is what I know. And I just wanted to share it with the community and with all of you.
How about testing facilities?
Testing facilities
And
are
once you get tested,
okay.
where does one go and how much does it cost and what kind of appointment or whatever?
Okay, so the vaccines are at no cost.
Right.
The testing that's questionable. I'm not sure. I have tested at least 15 times. I've never been charged. So
Okay.
Where?
I have gone to Rutland Hospital and I have gone to the independent sites that the health department set up, which I think now they don't have because there are so many other sites.
Does Mountain Valley-
It used to be you could go to
Mountain
the
Valley
back
will test you.
side, but you need an appointment.
You should always call to
Right.
be sure that you're going at the right time. You
Okay.
can call for an appointment. The health department, Springfield Health Department down on Mineral Street is offering vaccinations on Tuesdays from 9 to 1. And the Vermont.gov website, the phone number for that is 855-722-7878. And you can call there and find out where the closest place to your zip code is for an appointment. But you can
What's that number again?
855-722-7878. And you can just tell them your zip code and they'll tell you where you can get a vaccine. And you may
Or
decide that you
testing.
want to get Pfizer, or you want to get Moderna, or you want to get Johnson.
Is that testing or vaccine?
That's vaccine.
Okay.
Testing, you can get, testing is more available. You can call Mountain Valley, you can go to Springfield Hospital. You can,
What's the turnaround time on this?
it should be done within 24 hours. I knew my last test was a month ago and I don't do it anymore now, but the turnaround time was 24
If you
hours.
do need to get tested, it's available locally.
Because a lot of things that people are available to do, say you need a test within 72 hours.
That's so tricky. It really is. So I got a call from a local person who's having family come. They're coming from a southern state. They decided on their own to get tested. They're leaving on a Friday. They're getting tested on a Wednesday. You almost can't plug that hole. But they're doing the best they can. And I think that that's pretty awesome. We had another family the whole family came from South Carolina. The kids were sick. The grandmother got sick. The mother got sick. Was it COVID? Everybody got tested. Everybody went to the doctor and got tested. None of them had COVID. No, none of them had COVID. But you come with a weak cold and you really don't know. So you can't really take that chance.
No, you can't.
So everybody got tested. Those are just tricky things that it's really hard to plug every single hole, but I think we can do a better job Vermont's done a great job of vaccinating, but we have a transient population. People come from out of state and we really don't know who's vaccinated and who's not. So I just want to put that out there and you're welcome to call me and I can help you get vaccinated if that's what you want to do. Okay. Thanks very much.